Hi, everyone. Thank you again for joining us today, and welcome to another one of our webinars in our summer webinar series. My name is Lincoln Till. I am the Assistant Director for Orientation in the College Programming and Orientation Office, and I'll be serving as the moderator for today's webinar. Our webinar today is focusing on pre-health programs, and will be presented by our College Academic Advising Office and our Careers in Healthcare representative here. The majority of this will be hosted by them, and we will have a Q&A at the end. So if you have any questions, there is a Q&A box at the bottom of your screen. You can go ahead and type those in. We'll answer some probably as it's going along, and then we'll answer some for the whole group at the end as well. And yeah, with that, I will pass it on over to our College Academic Advising Office.
Awesome. Thank you. And thanks everyone for attending our pre-health information session. This is, as we said earlier, being co-hosted by the College Academic Advising Office and Careers in Healthcare from Career Advancement. And this webinar is intended to help you understand more of the general academic path that pre-health students take in order to complete the prerequisites for graduate school applications, and as well as learn more about the overall scope and support and resources available to pre-health students. So as Lincoln said earlier, we will have a Q&A function, and we'll have some academic advisors there to help answer any questions you might have during the presentation. We'll also save some time at the end of the presentation as well for any in-depth questions that come in. So we'll have time to talk about it more in like the larger group setting. But first, before any of that, we'll have a presentation from Careers in Healthcare, and hopefully that'll answer some of those initial questions you might have too. So, but before we dive into the presentation, we'll just start with some quick introductions. So, hello, my name is Catherine McElravy, and I am an academic advisor in the college, and I'll pass it over to Debbie.
Hi, everyone. My name is Debbie Coyle, and I'm also one of the academic advisors in the college, and I will hand it over to my colleague, Caroline.
Hello, everyone. My name is Caroline Loki, and I am going to get my presentation set up, and then we'll jump right into our topic today. Right, so welcome. I just want to start by saying we're really excited to have you join the University of Chicago family, and I'm really excited to meet all of you when the academic year starts or before, and help you on your journey towards a career in healthcare or medical school or both. So this presentation is going to cover the basics that you're going to need to know as you start your academic journey here at the University of Chicago. An alternative title for this presentation is being pre-med at the University of Chicago. So we're going to talk about the resources you have as a student interested in healthcare, primarily by introducing our team, Careers in Healthcare, which will serve as your pre-med advising team and your career advisors for students interested in healthcare generally. We're also going to talk about the advising basics that you'll need to know about how pre-health advising works at the University of Chicago, what resources you have access to, and how we are here to support you on your journey from today all the way through when you matriculate into medical school, regardless of when that happens. So we work with alums in addition to current students throughout their journey as a pre-health student. So we'll talk about that. We're also going to talk about some common questions that first years or incoming students or early career pre-med students have around things like majors, required courses for medical school admission, general academic concerns or questions you might have going into your college career. We're also going to talk a little bit about grades. I know that's a big concern for our pre-health students and pre-med students, maintaining a strong GPA. We'll do a little bit of myth busting about what is a strong GPA from the University of Chicago. I'll share some general statistics, answer any questions you have about that. And then finally, we're going to give you some next steps, some things to do in these next couple of months. And once you arrive on campus, in the fall to get yourself off to a great start and to orient yourself to the amazing resources you're going to have as a pre-health student at the university. So to start with, I'll introduce myself a little bit more fully, as well as the Careers in Healthcare team. So as Catherine mentioned, Careers in Healthcare is one of the careers in teams that is housed in Career Advancement, which is our career services office at the University of Chicago. Career Advancement is located in Ida Noyes Hall. So come visit us on campus when you're here. But our careers in teams span all of the possible interests you could have in terms of a career outcome post-graduation, including business, social policy, education, computer science. So regardless of where your interests end up, there's a careers in team for your specific goals. So that's how our office is structured, and the Careers in Healthcare team is the dedicated advising team that will help you explore the variety of things you can do in the healthcare field. And if medical school is in your journey, prepare for that process. So as I mentioned earlier, my name is Caroline. I've been a pre-health advisor for 10 years now. I've been at the University of Chicago since June of 2022, and prior to that, I was a pre-health advisor at the University of Pennsylvania. I have two colleagues that work closely with me who are not here today, but who are also pre-health advisors, and so you might work with them throughout your journey here. I have Elise Gruneisen and Swapna Shah. So you can meet with any one of us. You are not assigned a specific advisor at the University of Chicago for careers in healthcare. You are welcome to meet with any one of us. You will be assigned a first-year advisor, and if you indicated that you have an interest in healthcare, it is very likely that you've been assigned to one of us, so either myself or Elise or Swapna. That being said, if you were not assigned to us, you are still welcome to meet with us. So your career advisor will be that point person for you, that person that you can always reach out to and ask questions about our resources and our opportunities. But you are welcome to meet with anyone in the office as your interests grow and change. So that's a little bit about careers in healthcare. I'll also talk about what we offer and how we can help. So the cornerstone of the work that we do with students is going to be those one-on-one advising. And I'll talk in a second about what our typical advising appointments look like, what kinds of questions students come to us with. But just know that we're always here with any question you have related to your career goals, related to your pre-med journey, related anything to your goals along those lines of your placement after graduation and your career journey during your time at UChicago and beyond. So you're always welcome to reach out to us via email or a scheduled appointment anytime you have questions. We are also your resource for any internships and full-time roles you might be exploring. So once you start thinking about what you want to do over your first summer and every subsequent summer, we can help you think about what makes sense for your specific career goals, for your specific interest in medicine, and help you find and really substantive summer experiences. So if you have questions about that, we are your resource. If you decide you want to work full-time before you attend medical school, or if you decide you want that you want to start a career in a part of healthcare that doesn't require medical school, we're going to help you find that first post-grad job. So if that's part of your journey, we'll help through that as well. We also have specific programs and cohorts that are designed to both help you explore the field more in depth and gain the experiences that are going to be useful along your pre-med journey or along your career journey more generally. And then finally, Careers in Healthcare has a robust support for current applicants to medical school. This is our CAS system, which stands for the Current Applicant Support Series. And this is a series of individualized comprehensive support for you throughout the application cycle. So you might be aware of the med school application is a very lengthy, there's many moving parts. It involves a lot of writing and a lot of reflection. And it is something that we are here to support you with through every step of that journey. So we work with applicants for 2 full years, so a full year before they submit their application to medical school, and for the full year while they're in the application cycle in navigating interview invitations and interviewing and negotiating offers. So you will be part of the CAF system when you apply to medical school for 2 years, like I said, a year before you apply and during that application year. And the cornerstone of CAF is really unlimited statement reviews and writing application support, as well as advising about school lists and interview preparation and really everything that you need for your specific goals. So that's an overview of careers in healthcare and how we support our pre-med students and our students generally interested in careers in healthcare. So as I mentioned, advising appointments are how we spend most of our time, and how we really get to know you as people and get to know your specific goals, and help support you on that individual journey. And so we do those primarily through 30-minute appointments, one-on-one, just you and your advisor, talking about what's ever on your mind, checking in, helping strategize next steps, making sure you're taking advantage of all the resources here on campus to really explore healthcare and figure out what your passion is in the field. So career exploration is something that we commonly talk with advisees during these appointments. So if you want to apply to a medical school, you even know what specialties you might be interested in pursuing once you get there, great. We're happy to work with you at that point. But if you're unsure about medicine, if you're considering multiple things, we're happy to have conversations about how to start figuring out what's the right fit for you and how to explore the things that you think you might like during your time as an undergrad here at Chicago. We can also talk about things broadly related to this question of what medical schools are looking for or questions specific to our pre-med applicants. So first and foremost, that might be prerequisite courses that you need to complete to be able to apply to medical school, your Gen Bio, your Orgo. We can talk about GPA. We have very, very detailed statistics about our applicants' performance over the years, in terms of GPA, individual schools. We can advise you on your competitiveness based on those factors. And most of the time, those conversations are trying to take some of the anxiety around the GPA down and encourage students that really perfection is not required by medical schools. And we have the data that we can share with you so that we can make sure you're feeling good about your academic progress. We can also talk to applicants about MCAT, so general study strategies, timing for the MCAT, the competitiveness of scores, talking about potential retakes. Any questions regarding MCAT, we're happy to have. We are also happy to have talk about gap years. So whether you want to take a gap year, meaning time between graduation and matriculating into medical school, or you're unsure, we're happy to have conversations about the positives of that, the negatives. There are none, but we can talk about how that might fit into your overall goals and your priorities. Internship, summer experiences, and job search. So there's a lot that goes into building a strong application to medical school or building a strong resume for a job search. And we can help you find those experiences that are going to both allow you to really explore a field thoroughly, make sure it's right for you, figure out where your passions and your interests lie in that field, but also build that strong application so that you are ready to apply to medical school when you want to, or you have a great first job when you graduate. Application competitiveness is certainly a big topic of conversation in our advising appointments. It's a great idea to check in with us regularly, maybe once a quarter or twice a quarter, just to talk about what you've been doing recently, talk about what you're concerned about, talk about what your goals are for the next quarter or the summer. Just a general check-in to make sure you're making the progress that you want to, so that you're ready on your timeline and your goals are going to be accomplished in the way that you set out towards. And then, of course, we are not limited to these conversations. You're welcome to bring to us any questions or concerns you have generally about being pre-med, about the med school application process, about what successful applicants have done in the past, about healthcare in general. Okay. Now, to schedule an appointment, you can do that through Handshake. So Handshake is the platform that Career Advancement uses for appointment scheduling, but also jobs and events. So it's a great resource to learn about what's available to you through our office, internships, job postings, events, and appointments, as I said. If you are part of the first year career cohort program, you've already received an email from your career advisor introducing themselves and requesting that you schedule an appointment with that person. And so you can do that now. If you are not part of our first year career cohorts, you will receive that email not next week, but the following week. As I was mentioning, if you indicated an interest in healthcare or medicine, you're very likely assigned to me or Elise or Swapna. If you were not assigned to one of us, you're still welcome to meet with us. You just schedule on Handshake as this instructions say. So you go to the Career Center, you click schedule an appointment, you click for first year advising to schedule with your advisor. And you choose your time that works for you. So we're really excited to be meeting with students over the summer. It's a great opportunity for us to introduce ourselves one-on-one to you, learn more about your background, learn more about where you're at, learn more about your interests, and establish our working relationship. So. One thing I would recommend that everyone do now is to sign up for the newsletter. So the Careers in Healthcare newsletter is not sent during the summer, but it is sent every week during the academic year. And it is a great resource for you to be on top of everything that our office is doing and everything that our team has available, whether that's events, whether that's really interesting volunteer opportunities, whether that's wonderful summer internships, all of that's going to be shared in that newsletter. And that's a great resource to check weekly and to see if there's anything that is appealing to you and to apply or attend those. All right. I'm going to move now a little bit to some concerns, not concerns necessarily, but topics of interest for incoming students and for first years in particular. So I want to start by debunking some myths around majors and academic choice. So the first myth is that medical schools might prefer science majors like biology or neuroscience. The truth here is that medical schools have no preference for major. We have wildly successful applicants who major in anything and everything that the college offers. We have classics majors, Germanic studies majors, Meng majors, biochemistry majors, plenty of wonderful biology majors and neuroscience majors. But the truth is, your major decision can be a decision that is fully based on your specific academic interests, your intellectual passions, the things you want to spend your time studying. And the truth is that medicine encompasses all of the human experience, truly. So everything you study in the college can be relevant and useful for you in in your journey towards becoming a wonderful physician or a great researcher. So we encourage you to pick a major that you really enjoy and that you find intellectually engaging. For many of you, that's naturally going to be a science major, a biology or neuroscience. It's a good thing that pre-med students like the sciences, but if you have an intellectual interest that you want to explore that's not biology or that's not neuroscience, please do so. It will not put you in any disadvantage. If anything, it's going to be a positive because that passion and that intellectual curiosity and all of those wonderful things are really important to medical schools generally and will come through in your application when you're ready to apply and when you're interviewing with schools about your academic experience here at the university. On the other hand, don't feel like you need to major in something unique. Really, there's nothing that you need to do that's quote unquote unique to stand out to medical schools. So again, the corollary to like, don't major in biology if you're not excited about biology is also don't feel pressure to do something that you think will make you stand out if that's not what you're really passionate about. Another common question we get from students is there a benefit to double majoring or to completing a minor? Is that going to make me stand out and show that I can handle the rigors of medical school? In our experience, double majoring or minoring does not make any difference in terms of medical school admissions. The University of Chicago is a rigorous academic institution. Medical schools know that. Just completing the core curriculum in your one major curriculum is doing plenty to show that you have the academic chops and the abilities to succeed in medical school. So don't feel pressured to do that for admissions reasons. That being said, if it's something you're attracted to because there's two areas of study that you're really passionate about and you want to do that, great. But again, it's not something that you need to think about from the perspective of, will medical schools prefer this or will they like this? All right. Similarly, I think students feel like they need to take like the hardest courses in their major or do graduate courses in their major or really take advanced courses to again show that academic rigor. Similar to this idea of double majoring or minoring as showing specific academic chops. It's not necessary, and it again is something that you should do if you feel compelled to, if you're really curious about those courses, if it's something that you want to, but medical school admissions and what these committees are going to think about your portfolio is not really a consideration. And then finally, you may be, exploring the course catalog and seeing the difference between BS and BA degrees. This again is not something that is a consideration or that medical school admissions committee shouldn't be part of this consideration for you. The BS degree, which often requires a thesis or advanced work, those things are valuable in and of themselves, but not necessarily just to get that designation. So to give you an example, one applicant that I worked with last cycle was a biology major, but his interests in research were in community health research. And he came to me and said, oh, should I leave my research group that looks at HIV elimination in Southside patient populations and do a basic science bio so that I can complete a BS degree? The answer to that was no, not unless you want to do that from an intellectual perspective, because the research that they were currently doing was really aligned with their interests, with their goals as a physician, with what they wanted to do in their career. And that's what's going to be appealing to medical schools. So make your decisions about your academics based on what you find intellectually engaging and what you find interesting. And you can keep, the concerns about what med school admissions might think about those generally out of your decision-making process. Okay. So as you're thinking about what might I want to major in, will I minor, what other sort of academic choices I'll be making, this first year or subsequent years. For pre-med, you're best to follow your passion. Feel free to explore anything that you find interesting. I think it's a good idea also to explore healthcare in a variety of ways. So if you have some electives or some time in your schedule, take a bioethics course, or maybe take a course on medical anthropology. So, it's a good idea to explore and see what's out there and follow your passion. Without really thinking too much again about strategically what do medical schools want, what is best for them. Okay. Now we'll talk a little bit about prerequisite courses, and this is where my colleagues in college advising are the experts in terms of how this will look in your actual schedule and in the courses that are offered by the University of Chicago. So these prerequisites are what we recommend all pre-med, as well as pre-dental, pre-PA, anyone who's interested in the health professions should complete this list of courses. So this will make you competitive or complete the requirements for about 99% of medical schools, as well as other health profession schools in the US. So we do always advise that applicants double check the policies, particularly of their state schools. So the public schools in the state that you're a resident, those are the schools that tend to be a little bit more strict about things like required courses. And so it's always a good idea to double check those schools. Those schools often have an in-state preference for applicants, and so you want to be eligible for those schools. If you are a Texas resident in particular, pay attention to those because they tend to require more biology than every other medical school in the country. So, but this list will get you, like I said, competitive for 99% of the medical schools in the country. And this is what we recommend everyone do as a start. So we recommend that everyone take 1 year of the following subjects: general chemistry, biology, organic chemistry, physics, and English. So that would mean 3/4 each of these. There's a detailed list on our website, Career Advancement, Careers in Healthcare, prerequisite courses, where you can see the different sequences that most of our students use to fulfill these requirements. But just keep in mind, again, 3/4 of general chemistry, 3/4 of biology, 3/4 of organic chemistry, 3/4 of physics. All 4 of those with lab, and then 3/4 of English. Now, most of our applicants fulfill the English requirement by either 2/4 of Hume, which is required for the core, and either 1 additional English course in any English course. So anything that the English department offers would work for this, as well as anything that's creative writing would work for this. Or you can do the full 3/4 of Hume. So you have some choice there. So those are your basic year sequences. We also recommend that each applicant or each pre-med student complete 1/4 of biochemistry and 1/4 of statistics. For statistics, that could be in any department. So it could be a social statistics course. It could be the biostatistics course that's part of the Gen Bio requirement. Or sorry, about the biosequence, that's part of the biosequence. Anything that has statistics content will count for that. So those are the general requirements. Typically, most people can complete these within 3 years. So it's common for people to start with the chemistry sequence, their first year, at Orgo second year, physics third year, and then biology somewhere in that early part of the first 2 years. In terms of AP credit and credit by exam, for most schools, they're going to want you to take additional courses beyond if you use AP credit. So for example, if you have AP credit for biology, they're going to want you to still take a higher level bio class for a grade at the University of Chicago or any institution you were at. So that tends to be the policy. If you have questions about your AP credit and whether you would need to take additional courses and how that would impact your pre-med prerequisite path, you are always welcome to email me, Elise, or Swapna. And our email addresses are at the early part of the presentation, as well as listed on the Careers in Healthcare website. So feel free to send an email. This is also something we'd be happy to talk through in our initial advising appointments that we have to do. Okay. All right, so academic advising versus pre-health advising. What questions should you bring to your academic advisor, and what questions should you bring to careers in healthcare? It's really a simple distinction when you think about it. So your college advising team is going to be able to answer questions about what Chicago wants or requires. So if you have a question about will this satisfy my core? Will this be counted towards my major? Will this interrupt my degree completion? Any questions about what Chicago wants you to do to earn your degree and to graduate on time would be a question that you want to bring to your academic advisor. If you have a question about what medical schools want, like will medical schools count this as statistics? Will this satisfy the biology requirement for medical schools? That's a question you bring to careers in healthcare. So just remember that distinction. If it's about what Chicago wants, about your degree completion, about satisfying the requirements of the university, your academic advisor is the person to bring that question to. And if it's about what medical schools want or require, bring that to careers in healthcare. So hopefully that helps you understand that distinction and how we both kind of work together to make your life a little bit easier. Okay. I want to talk briefly about grades. All of you are going to do wonderfully at the university, but if you struggle a little bit in adapting to some of the science courses or just academically at first, we want to make sure that you are not operating under the assumption that that grades need to be a certain caliber to be successful. So if you go to a medical school's website and they talk about their incoming class, you'll often see very high GPAs, like the median GPA for our incoming students is 395. And you may assume that, okay, that's what I need to get to earn to be a successful applicant. Our students get into medical schools, and great medical schools, with GPAs that are significantly lower than what you might see in university, or sorry, in medical school advertising. So, for example, Stanford Medical School advertises, I think, 393 as their median science GPA for accepted applicants to Stanford. Our students, the median is 373. So please don't assume that you need to be perfect, that you need to have a super high GPA to be successful. Our statistics bear that a 3.4 science GPA is very competitive for medical schools across the country. So just want you to come into the university without these expectations or feelings that you must perform at a crazy high level to be successful. Similarly, a rough first year or even a rough couple of years academically will not harm your chances for medical school. When you apply to medical school, they calculate your GPA based on academic year in part so that they can see trends over time and see an upward trend. And for many medical schools, an upward trend is a very positive thing because it shows that you're resilient, you're adaptable, And when things don't go quote unquote right, you can course correct and show that improvement, which is a great quality that they're looking for. So, like I said, you are going to do wonderfully. But if you have a little bit of difficulty adjusting to the academics here, or you feel a little overwhelmed, or you feel like you're not performing the way that you wanted to, do not stress about that impacting your chances for medical school. And talk to us if you have those concerns. We're happy to walk through statistics with you, or just share anecdotal experience from similar applicants. Medical schools are looking for trends over time, so individual hiccups are not going to derail your application. If you have a really difficult class that you're just not clicking with and you have to withdraw from, or you get a grade that you're not happy with, that is not going to be a problem. So try not to stress about those things. Like, they happen, they're normal. Medical schools accept applicants to have experiences like that. And again, don't feel like you need to take the highest level that the university offers of courses, particularly for courses that maybe aren't your favorite, that you just need to complete for the core or for your prerequisites. You will, by virtue of attending this university and completing your degree and doing all the other amazing things that you will do outside of the classroom and professionally, you will have a great, strong application to medical school that will convince admissions committees at a variety of schools. One thing to think about, though, is that medical schools mostly will be paying attention to the science GPA. And so that is something to consider. The reason for that is because they want to make sure that you can handle the science curriculum. There's a logic to that. So as you're thinking about your performance, you do want to focus on that science GPA as you are as you're evaluating your competitiveness and your progress. Okay, and then you might be thinking, okay, so we've talked about academics, we've talked about grades. I know that there's a lot more to a strong application to medical school. What should I be doing outside of the classroom, particularly during my first year or my first couple of years at the university? The most important thing to start with is clinical experience. And so clinical experience is going to be interaction with patients, right? So talking to, learning about the experience of, and interacting with patients. So what you want to seek out early on in your time at University of Chicago is meaningful ways to get that clinical experience, to interact with patients. For our current students, so people who are, taking classes have all of those requirements in terms of academics and other things that take their time, we typically see clinical experience gained through volunteering. So that would be volunteering at a hospital, volunteering at a clinical site, volunteering with a community organization that works with patient populations. Any of that is great, wonderful experience, because medical schools are looking for your knowledge of the patient experience and the diversity of needs of patient populations, and evidence that you've talked to people and interacted with them, and that you like that type of work and that type of interaction. So what we recommend is, as soon as you're considering medicine, to find some experience where you can get that interaction. So we're talking about 2 to 4 hours per week is a good goal, and that could be done through volunteering. It's also, you can also gain great clinical experience through clinical research. So, U Chicago Med is a research powerhouse. Tons of work is being done in clinical research, and many of our students participate in clinical research labs and clinical research groups. And often in those experiences, you get to interview patients, enroll patients, talk to them. So that's another meaningful way that our students get clinical experience. So that would be my first recommendation as you're thinking about extracurriculars is look for an opportunity to volunteer with or work within the context of research a patient population that seems interesting to you and aim for 2 to 4 hours per week. The most important thing with your clinical experiences is that it's consistent and meaningful. And so consistent, we mean that longitudinal exposure. It's always better to have 2 hours over 10 weeks than 20 hours over the course of 1 week. So the longitudinal experience, that you do it consistently and that you do it over time, is important for showing that interest. Meaningful is important both for you and for medical school admissions. So it helps you test whether this is what you want to do with your life. And it also convinces medical schools that you have a deep experience with the kind of clinical encounter and with diverse patient populations, so that you know this is what you want to do professionally for the rest of your life. In terms of diverse, what I mean by that is you don't necessarily need to stick to the same clinical experience throughout, all 4 years or all 3 years that you're building your application. So, for example, if you start by, maybe volunteering at the playroom at Homer Children's and you do that for a year, but then you find a clinical research position, or you find a role as an interpreter in one of the free clinics around the South Side neighborhoods, you feel free to switch if you want some diversity in terms of different patient populations or different clinical sites. That's fine. Certainly, if you enjoy, the clinical experience you're doing, you can keep doing it. That's great, but don't feel like you have to do the same type for, your whole application building time. It's more that you have that consistency of some type of patient interaction. Okay. I do want to plug our healthcare treks. So we have a trek this winter break to Atlanta, and in spring we'll be going to Minneapolis, as well as Rochester to visit Mayo Clinic. These are great opportunities for you to meet alumni physicians and med students across the country, learn about the different practice areas and specialties in medicine, tour medical schools, and just generally explore healthcare careers. They're also really fun trips, and you get to meet other pre-med students and then have an enjoyable time together as well. So those applications will be opening later, but do apply for one of those if you're interested. And then finally, I'm going to plug the class of 2029 pre-med bootcamp. So this is going to be held Saturday, October 4th. So that's the first Saturday that classes are going to be in session. It's from 10 a.m. to 3 p.m. in Ida Noyes Hall. And it's going to have a wonderful set of information sessions, panels, and a lunch. So all the pre-health advisors are going to be on hand, as well as a panel of current upperclassmen who are pre-med students. And this is sort of your, we're going to go into much more depth of all of the topics and a lot more that we covered today. So definitely sign up to attend this if you're planning to apply to medical school at this point. This will give you everything you need to know to get hit the ground running and be ready to apply when you would like to. So we hope to see you all there. It's always a fun event. And if you have questions about it, you're welcome to reach out to me. Okay, so some things to think about over the next coming months. Attend the boot camp, so you could sign up for that on Handshake now. Sign up for the CIH newsletter so that when we start sending that again, you're tuned into all the wonderful events and jobs and volunteer opportunities that we share through there. Now is a great time too to create your resume. There's going to be more information about that in the email from your advisor welcoming you to campus. If you haven't already received that, you will again, not next week, but the following week. You're welcome to send your resume once you have that polished to your advisor to review it. That's a great thing to have done before you're on campus. So you're ready to go, you're ready to apply things without having to stop and fix that. Schedule your career advising appointments. Again, details about that will either already be in your inbox or will be coming very soon. And start thinking about what clinical experience you might want to do. We can talk about that in our advising appointments, what you might be interested, what you might already have done during high school. But if you do those things, you're going to be in a great position to start strong on your pre-health journey. And we're really, again, excited to meet you and to help you through your time here at University of Chicago and beyond. Remember, we work with alums too. But thank you so much for your time, and we look forward to answering questions.
Awesome. Thank you so much for sharing all that great information. It's great to see how much of a network and community students have when coming into the pre-health field and track. So yeah, and I thought, we could maybe ask some questions for the large group that have come in and kind of go from there of next steps. So one question maybe that came in a little bit earlier, but when you say pre-health, what does that encompass? Could that include just medical students, or is it also pre-dental? Is it PA school? Yeah, anything with that.
Question. So pre-health refers to anyone who is interested in a health profession. So most of our students are interested in medical school and end up applying to medical school. However, we have a contingent of pre-dental students that we support. We have a great pre-dental RSO with some wonderful people that are at the helm there. We have also a significant group of pre-PA students, and we do have a wonderful relationship with the Northwestern Physician Assistant Program. So we work closely with their admissions team to do wonderful events. I think March, we traveled by bus to their campus. We did a tour of their facility. They had a wonderful panel of PA students for us. And their admissions director is a great resource that, we can point you to have individual conversations with him. So yes, it encompasses everything. I apologize in advance for just saying pre-med all the time. That is a result of that being the majority of our population. But we, like I said, we work with pre-dental students, PA students, pharmacy students, and we can help you navigate that process as well.
Great.
Thank you. And I also saw a question come in that we addressed publicly in the chat, but I wondered if you could talk a little bit more about it. And it has to do with calculus, as whether schools are requiring calculus, whether it's recommended students take calculus the entire full year. Could you talk a little bit more about that and the prerequisite courses?
Yes, that is a fantastic question. So a couple years ago, we did a comprehensive review of medical school required courses and found that one school required calculus specifically. That's WashU. So we don't require, we don't require anything. These are recommended courses to meet the requirements of individual schools. But as a pre-health student, we do not think you need to take a specific calculus course for the purposes of med school admissions. Most of our students end up taking calculus anyway for U Chicago requirements. And so if you have AP credit, if you have to take the course for U Chicago, that's going to be, like I said, more than every school but WashU is going to require. So you are fine doing what U Chicago requires in terms of math, and essentially ignoring this idea that medical schools require calculus. Medical schools do require college math, and they typically by that mean statistics. And so that is why we recommend that everyone complete at least 1/4 of statistics. And most of our students do that through the biostatistics course that's part of those sequences, or through some other statistics course, either part of their major or just the general stats class.
Great. And in terms of, this is maybe like a two-part question, but in terms of like resumes and going about that process,
Mhm.
would you send your resume to your academic advisor or career advisor? And what might it look like if you're just graduating high school, and like what to include on a resume? Like what would it, yeah, what experiences might be on there?
Great question. Yes. So your resume, you want to send to your career advisor. And so as I mentioned, if you are part of our first year career cohorts, you will have already received an introductory email from that person in your UChicago email inbox. So check that if you haven't already. That's the person you could send your resume to for review. If you're not one of the first year career cohorts, again, you're going to receive that email not this Monday, but the following Monday. So keep an eye on for that. In terms of your first resume, right? When you are applying to things your first quarter at Chicago, your resume is going to be your high school experiences, right? And maybe some of the interests that you might have started exploring. So maybe you join an RSO when you get to campus, or things like that. But it's totally fine for your early, first year resume to primarily still be high school experiences. We have a resume template that we'll share in that introductory email from your career advisor that we recommend all students use. And so that is kind of you want to open that document up and start plugging in your information there. But I would say, in addition to the student groups and activities that you were involved in high school, any work experience, summer jobs, babysitting, summer camp, all kinds of stuff. You have experiences that are relevant and interesting to put on your resume because you gained admission to this university. So it's just a matter of translating that into the template that we provide for students. And then as you start to get involved in college experiences, as you start to, join a research lab, or, become part of an RSO, or get a summer experience, or do a trek, you can add those things and start generally removing some of the college, or sorry, some of the high schools.
Thank you so much. That's all really helpful. And if we have time for one more question, you mentioned earlier that on the Careers in Health Treks that people have an opportunity to connect with alum from UChicago, and also some connections that our office or our campus has with Northwestern's PA program. But can you also address if you can help students connect with professors and students at the Pritzker School of Medicine as well?
Absolutely. We will definitely help you find and connect with Pritzker faculty and physicians affiliated with UChicago Medicine and the university. So we found faculty at Pritzker and physicians affiliated with UCM to be amazing resources for our students. Really excited to work with your Chicago students. You guys are a resource for them. They want to have you in their labs. They want to have you contributing to their projects. And so this is a great conversation to have in that first meeting you have with us over these next couple weeks. So if you have a specific interest, if maybe you're interested in neurology or our cancer research or whatever, we can help sort of target faculty, figure out who might be of interest to you, and start those initial outreach. So most students do find research experiences and faculty mentors by cold emailing. And so we can help you draft those emails and find people. But generally, like, students have no problem finding a really interesting experience and a great mentor. And there's just so much great research going on and so much interesting things happening. So spend some time over the next couple of weeks, when it's too hot to go outside, and look at the website, find faculty profiles, go on LinkedIn, see what you can find, and come up to us with a list of things that you might be interested in or people that you might want to contact. We do also have formal opportunities that we share. So We have the Caton Scholars Program and the CIH Fellows Program. These are summer programs, so this is something you might want to apply to. These applications open in January, and these are the formal research experiences over the summer with faculty at the university and at the medical school. So there's things you can apply for too, but you can always reach out to anyone. And as a first year student, you have summer research support. And so if you find a faculty member who wants to work with you, you can work with them over the summer and you'll have the funding to do that. So again, it's a win for the faculty. So don't hesitate to reach out to them, introduce yourself, talk about your interests. That's a great way to get a wonderful experience. And that's how most of our students do it. Right.
Oh, nope. Okay, awesome. Thank you all again for sharing that information with us. And thank you all to everybody who attended today. As we mentioned, you can visit the websites, you can email them, reach out if you have any further questions, they're happy to help. And as a reminder, this webinar has been recorded and will be available on our website within a week. So if you want to come back as a refresher, or you remember a question being answered, but you don't really remember the answer, you can always reference this at a later time. And check out our orientation website, orientation.uchicago.edu. We have a ton more webinars coming up in the next couple of weeks, as well as some other newsletters and things that are being sent out to you. So go ahead and check that out and have a good rest of your day.